my name is Karen, your student nurse. Today I'm going to wash my hands, provide some privacy by closing the curtains. Can I get your name and your date of birth?
Aubrey Snow, 8/1897.
Okay, so patient appears to stay at age. Do you know where you are, Aubrey?
Detroit Mercy,
Do you know what day it is?
April 5th.
Okay, so patient is A&O times 3. Her grooming appears to be well kept. There's no obvious signs of illness. Her speech is appropriate. Her mood is calm and collective. Do you have any pain today? No? Okay, well, there's no signs of any illness on you, which is good. Do you have any allergies you need to know about? No? Okay. So we're going to move on to your head. So her head looks symmetrical, and she does look very clean. So we're going to go ahead and touch her. Okay, so there's no signs of lesions, and there's no bugs in her hair, which is good. It's symmetrical. Temperature is warm to the touch, which is normal. And go down to your eyes. Can you pull down your eyes for me, Aubrey? Okay, her conjunctiva is pink and moist. I'm going to go ahead and shine this light in your eyes. Okay. Her pupils are about 3 millimeters wide. Her eyes are symmetrical to her head. I'm going to follow my pen in. And then follow it again. Okay, so her eyes are perla. Her pupils are equal, round, reactive to light, and accommodating. Next, we're going to go down to your mouth, Aubrey. I'm going to have you pull down your lip. Okay, so her oral mucosa is pink and moist, along with her gums, which are also pink and moist. And smile, show your teeth. Teeth are white, open up. There's no cavities. Can you stick out your tongue for me? So her tongue is symmetrical in her mouth. It's down the midline. There's no coating. And I'm going to have you say, don't cough, ah. Okay, so her uvularis is midline, and her tonsils are about a grade 1 to 2. So next, Aubrey, I am going to have you puff out your cheeks and smile for me. Okay, and keep your eyes closed. I'm going to touch your face. Tell me where I'm touching.
Cheek. No.
Okay, so cranial nerve 5 and 7 are intact. Now we're going to go down to your neck, and I'm going to touch your neck for your carotid artery. Okay, another side. Okay, it's about a grade 2. Go ahead and listen with my belt. Okay, that is normal. Now I'm just going to have you lift your head up a little bit from about 30 degrees. Okay, and you can relax. No signs of jugular vein distension, which is good. Now we're going to go down to your arms. So her color is equally distributed. She has both arms. They are symmetrical. Her arms are warm to the touch. And she does not have any lesions, but she does have some moles. They're very small. All of them are about the same. There's about 4 on her left arm. They are symmetrical. The border is regular. The color is brown, evenly distributed throughout. And they're about 1 millimeter by 1 millimeter, and they are not elevated, which is good. So Aubrey, I'm going to go ahead and have you squeeze my hands. Good. So her strength is equal bilaterally. I'm going to test your fingers for cap refill. They're less than 3 seconds, which is good. And I'm going to have you put your fingers together like this. Okay, and there's no signs of clubbing. Next, I'm going to take your pulses, so I'm going to get both of your arms, please. I'm going to do her radial. Okay, so they're equal. They're grade 2. And your brachial. They are equal and about a grade 2. So next, we're going to go to her heart. So I'm going to show you some spots for her heart. Move this. Okay, so we're going to start on her right side, which is her aortic. Move over to the left. We have your pulmonic, her herbs, tricuspid, and then mitral. And the only one that isn't on the sternal border is the mitral, which is midclavicular line. So next I'm going to go ahead and I'm going to listen with my diaphragm first. but now I'm at the mitral where I would listen for a minute. But I am not right now, so we're going to switch. We're going to go back with the bell. Listen back all the way through. Okay. So what I heard was S1 and S2, no murmurs, and no S3 and S4, which is normal and is very good. So now we're going to go down to your lungs, and I am going to listen in the front first. Every time I touch your chest, maybe take a breath for me, okay? Now we're going to go ahead and listen on the sides. Good. And one more time. Good. Okay, now Aubrey, I'm going to have you sit up, please. Okay, now we're going to listen to her back. Again, her lungs. Okay, so lung sounds are clear. There's no wheezing or any of that. So now we're going to assess your spine. So Aubrey, I'm going to have you lean over a little bit for me. Okay. And her spine is straight, and there are no abnormalities there. So now I'm going to test for her CVA. So Aubrey, I'm just going to hit you a little bit. You're going to tell me you feel any pain? Any tenderness?
Nope.
Okay, great. Okay, so now Aubrey, I'm going to have you lay back down for me, please. I'm going to have you lift up your shirt. We're going to do your abdomen. Okay, so her color is normal. There's no lesions. Temperature is warm. Her stomach is flat. So now what we're going to do is I am going to listen to your stomach for bowel sounds. Okay, so your bowel sounds are normal. They're not hyper or hypoactive, which is good. And I'm going to go ahead and feel and tell me if you feel any tenderness, okay? Any tenderness?
No, your hands are cold.
Okay, I'm sorry. No tenderness? Okay. So next I'm going to say some organs that are in her abdomen. So her right upper quadrant is her liver and her gallbladder. Her left upper quadrant is her pancreas and her spleen. Her right lower quadrant is her right ovary and her ileum. And her left lower quadrant is her left ovary and her sigmoid colon. So now you can go ahead and lower your shirt. And I'm going to lift up your pants, okay? Okay. I'm going to take off your shoes now. Okay, so just looking at her legs, they're symmetrical. She has both legs. Hair distribution is even. Temperature is warm. There are no signs of edema. There's no lesions. So next, I'm going to go down and I'm going to do your pulses. So first is your doralis pedis. I'm going to lift up your socks so I can feel better. Okay, so these are about a grade 2, which is normal. And we're going to do your tibialis posterior. And these are also grade 2, which is normal. I'm going to put your socks back on. Okay, I'm going to have you swing over and dangle your feet. Okay, so I'm going to test your strength. So push against me. Okay, good. And then pull. So strength is equal bilaterally. It is about a grade 5. So now, Aubrey, what we are going to do is a get up and go test. So all I'm going to have you do is stand up for me and then walk over there. Okay, great. So her get up and go test is normal. I'm going to have you stand up straight, close your eyes, and I'm going to have you stay there for 20 seconds. Romberg test. And open your. Okay, so the Romberg test is negative. She did not fall over. And now I'm going to have you stand up and walk again for me so I can assess your gait. Okay, and her gait is smooth and it is rhythmic.